All right, everyone. What's up? It's Chris from chrisbeatcancer, and today my guest is Dr. John McDougall MD. And Dr. McDougall, some of you know him, some of you don't. I'm really excited for those of you who don't know Dr. McDougall because I am a huge fan of him and his work, and he has a long career of helping people get well with nutrition. And so, Dr. McDougall, thank you for doing this.
Well, good. It's nice to be exposed to a new audience, fresh audience, and hopefully many people, the word diet and health do go together well. I know for a lot of people they don't. I'm a board-certified internist, medical doctor. In other words, I'm not a holistic doctor. I'm not an alternative medicine doctor. I'm a regular, just standard practicing doctor who, about 40 years ago, lost faith in medicine as a young doctor because my patients weren't getting well. And I had the great opportunity to discover that food had something very important to do with nutrition, and that was when I was a sugar plantation doctor back in about 1973 to 1976. I worked on the Big Island of Hawaii, and I took care of first, second, third, and fourth generation sugar plantation workers growing sugar. And my first generation were very healthy. They were trim, didn't have prostate, colon, breast cancer. They didn't have rheumatoid arthritis. They had no heart disease. None of them were overweight, and they typically worked into their 80s and 90s. Now, this first generation population was unique in the sense that they learned their eating habits from their native land, like the Philippines, Japan, China, Korea. And they learned to eat rice and vegetables and very little meat, and no dairy in their diet, low-fat diet. And then they moved to Hawaii, to the Big Island, married, had families, and their kids, they got to the Western ways. They went to Texas Drive-In, and in 1974 they started going to McDougalls in Hilo, Hawaii. And they got a little fatter and sicker, and then the third generation, who I had a chance to take care of also, became as fat and sick as anybody else. So it became apparent to me as a young doctor that food had something to do with health.
Well, it's amazing to me that you made such a big transition in your practice, because there must have been so many doctors like you that were seeing these problems in their patients and drawing the same conclusions.
I don't think so.
And never changed.
No, I don't think, it's the kind of thing where unless your eyes are open, you can't see. Fortunately, my eyes had been opened about in 1971 in December when I met a man named Dr. Dennis Burkitt.
Yeah.
So he opened my eyes. Dennis Burkitt was a surgeon from Edinburgh, Scotland, who traveled to Africa, to Uganda, Africa, after his medical training. And he started practicing in Uganda and soon became the head of Ministries of Health of Uganda, Africa, and took care of 10 million people for 17 years. And what he told me at a noontime conference is he saw no appendicitis, no obesity, no colon cancer, no arthritis, no multiple sclerosis. And he told me as a young senior medical student this, and that's really where my eyes were opened. So my eyes kind of had to be open for me to see the plantation experience. And I think every doctor around the world can still see what I just talked about. I mean, you don't even have to be a doctor. You just be a general layperson and you watch TV. And you see that people in Asia used to be all trim. Now they're getting fatter and sicker. And the same thing with Central America and South America. People are old enough, and certainly your parents are old enough to remember when there were no fat people living in Mexico. Now Mexico is the fattest city, Mexico City, in the world. So I think everybody sees it. I don't know how you can miss what has happened in the world in the last 35 years in terms of the number of people who look like kings and queens. They see it, but their eyes aren't open, so they really don't see it. I was a unique doctor on the Big Island. Even though it was present for everybody to observe, it made an impact on me. And then after 3 years of delivering babies and doing brain surgery and everything else a general doctor in that area of the world had to do, I went back into training and to become an internist. And what I saw, because my training facility is right next to the Hawaii Medical Library, is I saw that there were thousands of articles that had been published on the cause of common diseases due to the Western diet and also on the treatment of our common diseases with a diet that's based on starch with fruits and vegetables. There's one of my mentors who I never met is a guy named Walter Kempner from Duke University who did the rice diet. And pretty much everything that I know, he published by the time I was 7 years old. So, the material has been there. It's just collecting dust on library shelves because it's of no value, and that's the problem. Still today, medical schools do not teach a thing about nutrition, human nutrition. In fact, in 2011, I was the force behind SB 380, which is a California law signed by Governor Jerry Brown, which forces doctors to learn about human nutrition, yet they still break the law.
Sounds like a good thing.
Anyway, I was my eyes were opened, and pretty much by 1977, I knew everything I know today. Started practicing medicine. As a typical doctor, I had to put shoes on the kids, so I did some standard medicine for a while, but then I got freedom from that in about 1985. I was able to do nothing but take care of people with a dietary approach. Did a live-in clinic in California, starting in 1986, and then starting in 2002, I set up my own clinic here in Santa Rosa. So that's pretty much what I do. I take fat, sick people who get fat and sick from eating meat and oil, and I put them on starches, vegetables, and fruits, take them off their drugs, and they get well most of the time. Yeah.
Now, there's so many directions I want to go here, but let me touch on one thing. So, rice. So I was in Cambodia last year, and someone tried to tell me that rice was the reason that disease rates were growing in Cambodia.
No.
And you've probably heard this before. I know you have. And so what's your response when someone says something like that?
Well, it's contrary to the data. I mean, people eat less rice in Cambodia and China. They eat more meat. Now, all you have to do is look at the food distribution data throughout Asia. In the last 20 to 35 years in Asian countries, the amount of meat and dairy has doubled. The amount of vegetable oil has doubled. The amount of rice consumed is down. So they can say whatever they want, but it doesn't fit with the data. It's just like, they have the second highest number of Tesla supercharger stations is in China, for Tesla cars. Mm-hmm. These people are very rich, and they have taken their wealth, and they bought beautiful homes and beautiful cars and fast food restaurants and steaks and meals that cost thousands of dollars a meal. I mean, this is just nonsense. The reason people have become fat and sick in Cambodia and China and Japan and Mexico and every place in the world is because of fossil fuel, the technology revolution that's taken place over the last 100 years that has been able to bring the richest foods known to humankind to almost every individual walking on the planet. That's why people are sick. Once upon a time, only a few people ate like kings and queens, and they were fat and had the gout. Now, even if you're on welfare, even if you're on Cambodia and all you make is a few dollars, you save them up to go to McDougalls. This is no mystery, folks. And if you take people who are fat and sick from eating rich food and you put them back on the normal, natural human diet, which is a diet of starch, rice, potatoes, corn, beans, breads, bread is the staff of life. And the Middle East, which we're watching every night on TV, Egypt, Iran, Iraq, that's the breadbasket of the world. You say in China, when you say hello, you say, have you had your rice today? That's the good morning greeting. Rice is synonymous with food. Anybody who makes a statement like that is they're just ignorant of everything. Everything they see, all the statistics. Why anybody would say that, I don't know. It's the same reason people say potatoes are fattening, and they continue to get fat and sick. Potatoes are an ideal food.
Well, it must be frustrating to see how much momentum the low-carb movement has gained and made, where people are eating more meat than ever, more fats and oils than ever, and demonizing whole foods and starches.
Well,
and I've heard you talk about these things, but what do you think's behind that?
Well, let's see. There's a lot of money behind it, industry. People like to hear good news about their bad habits, so somebody tells them it's good to eat bacon. And I think the media is very much at fault because they will say anything to grab a headline. So if somebody can put out a headline in the New York Times or the Wall Street Journal that says, new studies, new book says that all the past experts were wrong. You're not supposed to be eating grains and potatoes. You're supposed to be eating bacon, butter, and brie. So Time Magazine and other newspapers are very guilty of doing anything to grab headlines. I've seen it happen. I've been around for 40 years. I went through the time when Robert Atkins was king. He recommended bacon, butter, and brie, and his foundation continues. They've apologized for this very, very, very dangerous diet, and it's still dangerous, by adding some non-starchy green and yellow vegetables. That's somehow supposed to compensate for all the saturated fat and E. coli and DDT and other chemicals and garbage in it. But I want to get back to your statement of frustration. The low carbers, in addition to being wrong about health, they're taking a stand that's destroying planet Earth. That's the thing that bothers me most, even if they're right. And there's always a little bit of truth to everything. If you eat a diet without carbohydrate, a diet that has virtually no sugar in it, you go into ketosis, you get sick. That's a condition of illness. And when you get sick, you lose your appetite, you lose weight, and that's how these ketone-producing diets work. So you can lose some weight, and as a result, your type 2 diabetes can get better. Your cholesterol and bad cholesterol go up. You have horrible constipation. You have terrible bad breath. This is all published and without any question. But you can fudge the figures enough and set your experiment up enough if you got the money to show pretty much that a low-carb diet causes you to lose weight and maybe improves the diabetes a little bit. So even if they're right that it had a health benefit, the impact on the animal rights issues, factory farming, it has a horrible impact on things that every one of us who watches TV knows is wrong. And the impact on the earth is just inexcusable. In fact, when these low carbers agree to talk with me or any other person in my camp, part of the agreement, and I won't agree to it, but part of the agreement that other speakers have had to make is that the environment and the issues of animal abuse, whatever you want to call it, the horrible things done to animals, it's a pre-agreement that will not come up in the discussion. Because how could anybody justify what's going on with the production of livestock when the production of livestock accounts for at least half the greenhouse gases and horrible erosion problems throughout planet Earth? It is the major polluter on this planet. So when somebody recommends this kind of diet, a low-carb diet, they've lost their moral compass. These people are, I don't know how they can go to bed at night, sleep at night. In addition to the terrible harm they do to individuals who follow the diet, the terrible harm they do to the planet and all of its creatures, I just don't know how they can do it. They have some soul searching to do. They've lost their moral compass.
Can you talk about how diet causes cancer?
How does diet cause cancer? That's something I've been studying for 40 years, and I don't have the answer. There's a guy.
You have some ideas.
Some ideas. There's a guy. We could go back to Otto Warburg, who did studies in Germany in the 30s that made normal cells anaerobic, and they by depriving them of oxygen, and they turned into cancer. And I think Otto Warburg's thoughts are good. There are a lot of chemicals out there in the environment which damage our DNA, and that's probably a major issue in terms of turning cells into cancer. And then, you got to initiate the cancer by chemicals. I would have to guess chemicals are probably the main initiator. And then once you have the cancer initiated, then it needs to be promoted. And there are lots of things that promote cancer. There are components of food. I'll tell you the answer. The whole diet promotes it. But scientists, they're reductionists, and they like to figure out what every little detail is as far as what's causing cancer. We know that fat, and especially vegetable fat, promotes the growth of cancer in animals. Cholesterol acts as a co-carcinogen. Dietary fibers have an anti-cancer effect. There are some vitamins that have anti-cancer effects and minerals in certain doses, but in other doses, there are some minerals that have cancer-promoting effects. So to microanalyze the diet and say it's this particular part of the diet, or it's only radiation, or viruses. Viruses, by the way, also cause cancer. We know that, and those viruses lurk in meat and dairy. I mean, I'm not going to tell you most of it. They're in meat and dairy. Your bovine leukemia virus, your bovine immunodeficiency viruses, many types of cancer viruses are in these animal foods. So as far as microanalyzing it and say which component of the rich Western diet is most dominant in initiating and promoting cancer, I couldn't say. But I'm pretty sure I know where it comes from. I'm pretty sure I know where colon cancer comes from. It's from things you put in your colon. And I'm pretty sure I know where lung cancer comes from. It's from things you smoke. But it's a little more complex than that. And I think anybody wanting to prevent cancer, major cancers, there's some obvious things to do. One would be cigarette smoking. Another would be not to get too much radiation from any source. But the food is everything. It's everything. It's your major contact with the world around you. So I would focus on a good diet to prevent common cancers, even lung cancer. There was a study done by one of my friends, Ernst Winder, Wynder, and he's been probably dead for 20 years, but he studied the rate of lung cancer in Japanese males. 60% of them smoked at that time. And he found that lung cancer in Japanese in Japan was 1/4 as common as smokers in the U.S. And he said the reason is you take this tube of poisonous stuff and you suck it in your lungs. If you eat an unhealthy diet, like the American diet, you can't defend and repair as efficiently as you should be able to. And so the noxious effects, the toxic effects, the irritating effects of the tobacco become very dominant because of the rich Western high-fat, low-plant food diet. Whereas in the Japanese, when they perform the same behavior on their very low-fat, high-starch, rice-based, vegetable-heavy diet, their bodies are able to defend and repair damage from the cigarette smoke as well. So diet affects all kinds of cancers. A study published in the New England Journal of Medicine in the 90s showed that skin cancer rates in people who got sun exposure varied greatly on a low-fat diet. You had 1/2 to 1/6 as many skin cancer recurrence of pre-skin cancers. And so even diet affects skin and lung cancer that you wouldn't think were related to diet. And a cause for both of those. But diet still influences those cancers. Not only the cause, but the promotion. And so this is a big message for all of us who want to prevent cancer. But some people already have cancer. In my February 2015 newsletter, I wrote a whole article about the dietary treatment of cancer. And I wrote it with two bookends, so to speak. I published the first study in 1984 on the dietary treatment of breast cancer. And that study is available in my February 2015 newsletter.
Now, was Dr. Ruth Heydrich a part of that study?
She was. She was one of my patients. Yeah. And, of course, she's alive and well today, and I see her quite often. She was 48 when she got her breast cancer, and I think she's 82 now, something like that.
And you've seen she was not an anomaly, correct? You've seen other people.
I've seen others. Yeah, I've seen
from cancer with diet changes, correct?
I have, and it's been published in the scientific literature, and you'll see those publications in my February 2015 newsletter.
I'll link to it. Yeah.
Well, that was all good and well that I published this small study in a very obscure journal, and it got no attention except for maybe behind my back. I don't know whether anybody laughed. But it kind of sat there, and then there were a few other pieces that appeared along the way. In fact, quite a few others. And the information got to the point where February 13th, 2015, the American Cancer Society came out and officially recommended that people who have cancer of the breast, colon, prostate, melanoma, etc., who already have cancer, need to change to the kind of diet I recommend to increase survival. The American Cancer Society says so in an organization called Up to Date, which many doctors look to for a synthesis of correct advice. That same February of 2015 came out with an official recommendation that patients with cancer should be advised to eat a low-fat, plant food-based diet. So it's general recommendation. In fact, I would consider it malpractice. It is malpractice. You don't have to just consider it. it's malpractice for a patient with any patient to go to the doctor and not be advised correctly on diet, but particularly somebody who has a dietarily caused cancer like breast and prostate and colon. Maybe it'd be like going to a doctor with, say, a breast cancer, and you believe that you should remove the lump, and I do believe you should remove the lump. It's like a person going to a doctor with breast cancer with this big tumor, and the doctor forgetting to recommend any standard therapies. The patient walks out and says to the family, well, what did the doctor recommend? The patient says nothing. And then they call the lawyer, and what did the doctor recommend? And the patient tells the lawyer nothing. The lawyer says that's malpractice. We'll sue that bugger for millions of dollars. Well, it's the same thing about not telling the patient they should change their diet. You go with heart disease or breast cancer or type 2 diabetes or whatever, and the doctor doesn't stand up on top of his or her desk and jump up and down and say, you need to change your diet because it's going to be the major factor in your cancer and your heart disease and diabetes. It's just blatant malpractice that goes on, and so far the doctors and the hospitals have been able to get away with it. Maybe their lawyers are richer than other lawyers.
Yeah, perhaps. Now, I've talked to a lot of, hundreds of cancer patients. You've talked to many more than me, but it's very common for them to tell me that their doctors told them to go home and eat whatever they want. So it'll be interesting to see how much of these recommendations actually make their way into practices. Right?
Well, unless there are a few lawsuits and national headlines, I don't think it'll change. And doctors know nothing about nutrition, even after the law that I wrote. And anyway, even after the law, SB 380 in California, nothing has changed. Nothing changes unless it's a legal issue or a financial issue, and neither one has come up.
Here's a loaded question. Do standard treatments cure cancer?
Some do. You have to define the word cure. They used to say cure is 5 years. I would say cure, good definition is you live as long as you would expect it to live. I think so. I think we have some treatments that are very effective for leukemias and lymphomas. And you remember Lance Armstrong? Remember that guy? Testicular cancer. And I think he was cured for all senses of the word. And I think there's some childhood cancers that are cured. And then you have the situation with, say, breast, colon, and prostate cancer, the very, very rare situation where it's a cancer that's going to spread but hasn't, and you just hit that time window where you caught it. That doesn't happen very often, like extremely rare. But I suppose you could say you cured that person. But in the process, you maimed millions of others with your treatments. In almost prostate, colon, or breast, it has either spread to the rest of the body, or it's not the kind of cancer that spreads. Or if it does spread, it spreads so slowly you die of something else first. Like when it comes to prostate cancer, over the age of 70, 100% of men have prostate cancer. Over the age of 50, probably half have prostate cancer. Yet only about 3% you ever see in a man's lifetime, unless you go looking for it. You do PSA tests or digital rectal exams and biopsies, then you find it, and then you find the cancer. But if you don't look for it, most men die with prostate cancer, not of it. Same thing with women. I could make the argument that 40% of women on the Western diet in their fourth decade of life have breast cancer all the way from very early stages to frank breast cancer, 40% in their 40s. All that doesn't manifest into disease. Same thing with colon cancer. There are a lot of colon cancers out there that people die with and not of. So do our present-day treatments of chemotherapy, radiation, and surgery cure cancer? It's pretty hard to see. If you look at the new cancer statistics that were published in December 2015, December 2015 from the American Cancer Society, you look at what's happened over the last 40 years in terms of survival from major cancers in men and women, it's virtually unchanged. These are hard fact cancers.
This is since the 1970s, correct?
Since 1975, yeah.
So it's probably December 2014 because we haven't made it to December 2015 yet.
2014, yes, it was 2014.
Yeah,
And
yeah.
yes,
So very little progress, right? And I mean, there's certainly statistics that say people are living longer, but
but
the
those
overall death statistic,
is the same. Mortality is the same. Living longer, surviving just means you're living longer with knowing you're sick.
yeah,
Early detection, instead of finding the disease, say you're feeling your breast, instead of finding it in the shower 3 years before you die, there's some meddling business out there and with doctors searching your breast diligently, so they find tumors really, really early. So you die here. If you find it in the shower, you die. 3 years. You find it 3 years before you died. But if you're doing mammograms and biopsies and all kinds of tests, you die here same day, but they find it here. So you've lived, you lived 7 years. They improve your survival. The only thing they really have done is turned you into a cancer victim earlier for a longer time to sell you more treatments and to have you suffer with knowledge longer. That's what improved survival is.
are mammograms useful?
For who? They're a $1 billion business. I mean, yeah, they're useful. They put shoes on my friends' kids. They do terrible harm. I recommend against mammograms as a screening practice. So does the Cochrane Collaboration, which is the most respected organization in the world for making recommendations like this. Cochrane says no mammograms. The U.S. Preventative Services Task Force says mammograms in women over 50 after thorough discussion with the physician about the benefits and risks, and the risks are overdiagnosis. If you screen 2,000 women with mammograms, you'll save one life. In the process, you diagnose somewhere between 5 and 50 women with breast cancer that would have never known they had breast cancer. They'd have never died of it. So you turn somewhere between 5 and 50 women to cancer victims in the process of saving one life. At the same time, you've caused somewhere between 600 and 1,000 of the 2,000 women to go through further testing and treatment because of this meddling. So do mammograms save lives? Rarely. Do they do harm? Always. Should they be done? No. Not as a screening technique. Neither should PSA, digital rectal exam. I recommend, and I hope I'm doing more good than harm, I recommend that the average person on the American diet get a bowel exam between the ages of 55 and 64. But this could be a stool test for blood or a new test called Cologuard for DNA changes that occur in polyps and colon cancer. It could be a sigmoid. Any one or all three of those. I think one exam to prove you don't have precancerous polyps, it would be a good thing. I can change my mind, but I recommend that now. I do recommend against a colonoscopy. Far too dangerous for this information. With a colonoscopy, they take a 6-foot-plus tube and they ram it up your butt, and 7%. Oh, and with an anesthesia, with a sedation.
Hey, I've had it done.
Yeah, and 7% of the people that have this exam with biopsies have major serious complications. And about 1 in 1,000, they have a perforation of their colon, and about half of these people die. So what you're doing is you're saving a life with colonoscopy. At the same time, you're killing about the same number of people and certainly harming a lot of them. That's why I don't recommend colonoscopy. If you accept colonoscopy, what you're saying to yourself and your family is you're willing to risk your life today for the theoretical possibility that you won't die of colon cancer in 10, 20, 30 years. That's a pretty major bet, But especially when you can get similar information, as valuable information by the three things I mentioned. Fecal
non-invasive testing.
Yeah, well, fecal blood, Cologuard's not invasive, and the sigmoids are just a 2-foot tube with no anesthesia, virtually no adverse effects.
That's really interesting. I've had a few colonoscopies in my day, and thankful there were no complications.
Well,
but given the choice, I would rather do any of those other tests.
Yeah, I've never seen a colonoscopy hurt a doctor ever.
Well, I hear you.
They're happy to give them. I get in arguments with gastroenterologists all the time. But see, I know the science on this as well as they do, and they know what I'm saying is true. Yet, they got to put shoes on the kids. Now, let's be fair.
I understand. Yeah, I understand that. I was diagnosed at 26 with colon cancer. Young adult cancers are on the rise. I've
Yes.
met, what's that?
Yes, they are. There's just
Yeah,
a big article about young adult colon cancer. There's a big rise in them, and screening isn't recommended in this group either.
I know. It's a problem. It's a problem because
We
there
might
are,
do
I mean,
something. We might have to do something desperate, like have people eat different.
yeah.
This would be radical.
Well,
I mean,
insurance doesn't cover it till you're in your 50s, I think. And I know people that are like, man, I just, they know me and they're like, shoot, I want to get mine checked.
yeah,
Right. So I'm going to put links to these other tests, for anyone listening or watching,
yeah.
so they can look into that because I'm sure they're less expensive.
Well,
And
people for blood's just a couple of dollars. Cologuard's out new, and I think it runs about 600.
okay, still less than a colonoscopy.
Yes, and a sigmoid, which if you can get a doctor to do it, I mean that's what I did as a young doctor with actually a rigid tube.
Oh,
I do
wow.
this all day long in my office. That's what's part of my job. But to find a doctor to do a sigmoid, you have to put some work into it because they're all brainwashed into the colonoscopy business. And there's a good article. I don't have it at hand for you, but just recently about all the young colon cancers and how it's increasing in people younger than 50, which is an age where screening is not recommended. So what do you do? Do you screen everybody? Do you start screening kids when they go to kindergarten? No, what you do, I mean, what a sensible government, what a sensible healthcare system would do, what sensible people would do is fix what's causing colon cancer. It's a food. It's what you put in your colon, and we know how to prevent it. It's very easy to prevent. Maybe not, probably 100%. Yeah, you could probably prevent it 100% because there are parts of the world, like I was telling you about Dennis Burkitt, who took care of the people in Uganda. He never saw colon cancer. And 17 years taking care of 10 million people, overseeing 1,000 hospitals in Uganda, they never saw a single case of colon cancer. So it is a 100% preventable disease, and it's the food. And I know what kind of food causes colon cancer. It's the animal foods and the vegetable oils. And I know what to eat to not get colon cancer. You eat starches, rice, corn, potatoes, whole grains better, absolutely. You eat some vegetables and some fruits, and you stay away from the what I call food poisons. The food poisons are the animal foods, and that does include your little fishies. It's the animal foods, and it's oil. It's like corn oil, safflower oil, and olive oil. These are horrible disease promoters. And so anybody looking to be well, you're giving out links. You could go to my website and see a section I did called Dr. McDougall's Color Picture Book on food poisoning and how to cure it by eating beans, corn, potatoes, sweet potatoes, and rice. And it's a color picture book. It's actually 66 pages of color pictures, and it's in 22 languages now. So people in Korea and Japan and Turkey and various parts of the world, they can read it, even though there's probably only about 300 words in it. It's called Dr. McDougall's Color Picture Book on food poisoning. And the food poisons are animal foods. Just you want to understand. It's like if you said, I don't want to get disease from tobacco poisoning or alcohol poisoning. Well, I would tell you, don't smoke cigars and cigarettes and pipes. This is what you don't do. And you say, well, I don't want to die of poisoning from alcohol. I said, well, here's what a gin bottle looks like, and this is a whiskey bottle. This is what you don't do. So you say, well, I don't want to die of food poisoning, which is heart disease and breast cancer, colon cancer, and inflammatory arthritis like rheumatoid arthritis, obesity, diabetes. So that's food poisoning. You see it. Everybody, just look around you. All your friends and relatives have it. I don't want to die of food poisoning. Well, I say, well, okay, what you do is you just don't eat animal foods. That means animals that flap wings and move fins and limbs. And you don't eat animal foods, and you don't eat oil. Like corn oil or safflower oil, you don't eat any of those free oils. That's not food. That's at best a medicine, at worst a serious toxin. So I just took everything away that all of your viewers eat. So they say, well, what do I eat?
Not necessarily. I have some pretty healthy viewers.
But I think my generalization is pretty fair.
Yeah.
So I just took away all the food that their friends eat.
Yes, right.
And so now they say, well, what do I eat? Well, what you eat is what you love to eat. You always loved it. It's what your grandma ate, your great-grandma ate, and all your forefathers ate it. It's starch. You eat oatmeal and pancakes and waffles and For breakfast and for lunch, you have bean soup, pea soup, lentil soup. You have a burger made of grains. For dinner, you have mushu vegetables over rice. You have pasta with a marinara sauce, bean burritos. Last night, boy, Mary, my wife and I been together for a long time, 45 years. She made this unbelievable bean soup. These great, she loves to buy these fancy beans and got some tomatoes out of the garden. And so we had this extremely tasty bean soup and some bread last night for dinner. Well, that's what you eat. I mean, that's your food. The reason that when I mentioned these foods to you, beans and rice and sweet potatoes and broccoli, when I mention them, everybody listening is saying, oh, well, I like that food. You know, it's comfort food. I like mashed potatoes. Mashed potatoes is, of course, one of our favorite dishes. Well, I like that food. Well, the reason you like that food is that's your food. You see, that's your diet. So you eat starch. That's most of your food. Those are high-calorie vegetable parts like grains and beans and roots and so on. And you throw in some non-starchy green and yellow vegetables like broccoli and kale and lettuce. And those are side dishes. Let me say that one more time, real loud. Side dishes. The main dish is starch. And you eat a few fruits, and that's your diet. And you put a little salt and a little sugar over the top. You use a little bit, that's okay. And some of your favorite spices, that's okay for most people. And you cut your food bill from like 40, 60, 80%. You cut your doctor bill out completely, and your drug bill, pretty much drop that one too. And we've just been kind to the planet. Yes, you have. And you made a whole bunch of animals happy because you haven't sent them to the slaughterhouse. I mean, there is reason out there. There is a uniformity. If you start looking at things from this point of view, everything makes sense. Your wishes to save the planet, your disgust with factory farming. You know, the problem you have every time you walk down the meat aisle of Safeway or Whole Foods, you find every time you walk down that aisle, you whiff and you look and you get sick by the time you get to the end of the aisle. You're sick to your stomach and you go, well, I need to rationalize this somehow. Why is this food, this raw meat, chicken and beef, why is it making me sick? Well, because it's supposed to make you sick. It's not your food. My cat out here in Einstein, that's his food. See, I get this cat. He's a great cat. It's my last animal. Got this great cat. Boy, if I tell you, I take a baked potato or something, throw it on the ground in front of him, he doesn't know what to do with it.
My cat wouldn't eat it either.
Yeah, but you know, this same cat, which is one of the things that troubles me about this cat, is 3 or 4 times a month he brings a little dead mouse or a little dead bird to my back door. You know, with a big smile on his face, you know, how proud he is to bring me dinner. And I try and tell him, I say, Einstein, that's not my food. You know, so the problem is these animals that you're trying to eat aren't your food. The only way they can get you to eat them is they have to cook them thoroughly, not just boil them, because you won't eat boiled beef or chicken. I mean, you won't do it. It's disgusting. Not only do they have to cook it, but they have to cover it with sugar and salt and spice, and sometimes grind it up because it's too hard to chew, and sell it to you as meat. And they can't get you to eat the cheese unless they put heavy loads of salt in it. So these aren't your natural foods. You don't eat them unless the industry disguises them enough for you to get them down. Now Einstein, he doesn't need any salt. He doesn't need sugar on his chicken wing, or his little mouse he brings. He likes it just like it is. And he just won't eat those sweet potatoes I keep trying to give him.
So I want to ask you a fun question. If you were on a desert island and you only had one food, you had fresh, clean water, and you only had one food you could eat while you were stranded on this desert island, what would it be?
It would be some form of potato. It would be, I like white potatoes. But sweet potatoes work just fine. People have lived on potatoes and water alone out of circumstance. I mean, that's all they had. And they lasted for decades in great health. Potatoes have everything. It's the anti-scurvy vegetable. You run into problems of scurvy if you just eat grains and legumes. So you have to add, like the British were known as the limeys. Mm-hmm. They'd go out to sea in their boats, and their perishable vegetables that had sea in them, they would rot in a few days. But the grains and legumes, they would continue to be fairly fresh so they could be eaten as they went out to sea. But the grains and legumes have virtually no A or C in them, so they develop scurvy. So the British learned to bring the C vitamin along with them, which was limes, and so they were known as the limeys. Well, potatoes do the same thing. They're the anti-scurvy vegetable because they will cure scurvy also because they're loaded with C and A, and so are sweet potatoes. So I would pick some form of potato, and I would live in excellent health. I would be thin. I'm pretty thin now, but I would probably lose another 5 pounds or more because it gets monotonous eating just these potatoes, and so you eat less food. Yeah.
There's a pretty famous potato diet that was published, right? Where a guy lived on potatoes.
Sure.
Was it 30 days, 60 days, something like that?
We actually had him at one of our, we have these seminars twice a year. They're called Advanced Study Weekends. And we invite people who have important messages. And he was invited. I've forgotten his name, but he did. He worked for the Washington potato industry. He came down and gave a phenomenal presentation to our group. And he lived on potatoes for 30 days in excellent health, dropped his cholesterol, dropped his weight. There's another fellow right now that was just got in contact with me. He's from Great Harvest Bread, and he's living on bread for 30 days. And I just advise him to eat a bread that has some kind of fruit in it, like a date bread. And he'll do well. He'll do tremendous. If he has to lose weight, he'll lose 30 pounds, drop his cholesterol, his bowel movements will be great. And after all, bread is the staff of life. Potatoes have been the pillars of nutrition for societies for tens of thousands of years. We're talking about traditional food. I like to give 2 examples to people. In fact, it's in my last newsletter. I think it was August newsletter. Well, anyway, if you go to my website, you'll find all kinds of newsletters that I've written. But this one newsletter I did was about the diet of athletes. And not in that newsletter, but in a book, the latest book I wrote called The Starch Solution, it talks about the gladiators, how the gladiators of 2,000 years ago lived on barley and some beans. They were known as the barley men, gladiators. And the reason they lived on barley and beans is because they wanted to win. It was really bad form to lose in the Colosseum. I mean, you didn't get to go back if you lost. So they lived on barley and beans, and they were the winners. Anyway, that was a traditional diet for a gladiator. And in the last newsletter, I talked about the running Indians, the Tarahumara from northwest Mexico, who do foot races. They were in the past did foot races of 200 miles lasting several days. They just ran. They run. That's what they do in the society. They run all the time. They're in northwest Mexico in Copper Canyon. So it hits the news now because of the drug cartel. It's become a really, really nasty situation down there. But they live on corn and beans and squash. That's their diet, and they just run all the time. And then those of you who follow long-distance events like the marathons and triathlons, you find the top winners are from places like Kenya. The Honolulu Marathon was won by a Kenyan, so it's the Boston Marathon this year. And the Kenyans eat a diet mostly of corn and some root vegetables. They're basically starchitarians, starchivores, starch eaters. So your winning athletes have discovered this, that you need to live on a high-carb diet, carbohydrate load. But more sensibly, you need to eat the kind of diet that we're recommending, which is a diet of starch with some fruits and vegetables.
That's great. I eat a lot of starches. I'm a big fan of all the starches you mentioned. And the big challenge for me, and some people may have this, it's a little bit of a rare problem, but I have a very high metabolism.
Yeah. So
it's difficult for me to get enough calories to maintain my weight.
It can be.
Any advice?
Yeah, sure. You eat more food.
Yeah.
The Tarahumara do it, and the Kenyans do it. And Carl Lewis did it. He was one of our patients. You remember Carl Lewis?
Yeah, the runner, Olympic athlete, right?
Mm-hmm. And we've taken care of many athletes. You have to eat a lot more food. But then what you do in addition to get more calories is you eat some concentrated calories. The first choice, the athletes we feed, we give them concentrated sugar. And we give it in the form of, say, fruit juices or dried fruits. I mean, dried fruits, you could eat, dates. You could eat 2,000 calories of dates without even thinking about it. So you get a lot of calories there. And juices, calories too. I mean, they're not as ideal for the average person as the whole fruit would be. But the first step you would take would be to concentrate simple sugars. And then if you really want to add calories and fat, then you go to the nuts, seeds, and avocados. And some people need to do this. Or no, the next step, you'd go to refined starches like breads. Breads are easy to get calories, whole grain breads, no oil. Easy to get calories. Bagels, of course, really easy to get calories. But you'd go simple sugars, dried fruits, flour products. And then the next step would be to go to your nuts and seeds and avocados. And I can make you a fat vegan with nuts and seeds and avocados.
That leads me to another question. So I imagine from time to time you will have a vegetarian or a vegan come to you with health problems.
All the time.
Okay. And so typically, what do you see them doing incorrectly or doing wrong? What do you see wrong with their diet?
It's very simple, and they know it too. Yeah, they're eating vegan cheesecake. And one of these healthy margarines they put on every vegetable, and they're eating handfuls of nuts and seeds. And they're getting fat, and they get greasy skin at the very least. These are fat vegans. They eat the other big category of food that vegans eat, well-intentioned. I mean, a vegan has a lot of strength, has put a lot of effort into their life. They're trying to save animals and the planet, and that's all good. But they've hurt one animal terribly, and that's themselves. And one of the ways they do it typically is with fake meats and dairy products like Boca burgers and these cheeses that are 90% oil, and the hot dogs that are 70% isolated soy protein. So they go into these fake meats and dairy products and does them poorly. I mean, really poor health. That high protein, isolated protein is very hard on the kidneys and bones and liver, creates calcium stones, all kinds of serious problems from that concentrated, isolated vegetable protein, be it soy, which it usually is, or wheat protein, seitan. So these foods are quite harmful to the body, and then they're all loaded with fats, and the fat you eat is the fat you wear. So yeah, they're in trouble, and the problem, the way I approach them, I've never offended a person by calling them a fat vegan that I know of. It's a title of one of the chapters in my book, The Starch Solution. It's the title of a newsletter that's very popular on my website. Because I tell them, I'm saying this for you and your cause. You want to save these animals, and you want to save this planet. We all must. But you're telling somebody, you're telling your sister or your best friend this important message of animal abuse and destruction of our only home. And they look at you and they can't hear you because all they see is a fat, sick person. So your message isn't getting across. They go, wow, even if that's true, I don't want to look like you. So for a fat vegan, an industrialist, well-intentioned person with great integrity, that wants to do something very important for all of us, I need to deliver to them the fact that they need to change their vegan diet from fake foods and nuts and seeds and oils and all that stuff to a starch-based diet, so that when they present themselves in front of friends and family, they look and they say, hey, that's pretty cool. And if I could look like you, I'll do it.
Now, I know some people that are listening and watching have heard what you've said, and they think it's the craziest thing they've ever heard, because they're saying, I can't believe he said simple sugars. I can't believe he said eat bread and potatoes, right? And so would you briefly talk about, your career spans 40 plus years, correct? As a medical doctor. Yeah. Would you talk about the types of diseases that you regularly see patients reverse following this type of dietary advice?
Well, we published our results. You can go to the Nutrition Journal, October 2014. You can see results on 1,615 of our patients. So we can also go to research that's being published from Oregon Health and Science University on our patients with multiple sclerosis. They were studied by the neurology department there. Typically, people come to me because they're too fat. I don't want to be a diet doctor, quite honestly. I'm a regular medical doctor, but the most important thing for most of us is to look good, and being too fat is the biggest attraction. I get people with type 2 diabetes. I just finished a program, actually, a couple days ago. I've been running so many. I started another one on Friday for Whole Foods Market. So, we run hundreds of people through programs that I run in Santa Rosa, California. It's titled the McDougall program. And what we published is an average weight loss of over 3 pounds, eating as much food as you can possibly stuff in your face over 7 days. That's in thousands of people. I've shown that people will maintain that diet and weight loss of 20 pounds for a year. We showed that with OHSU, our study there. So not only will they lose that weight in 7 days, they'll maintain a 20-pound weight loss at least over a year. Average cholesterol drops are 23 points in 7 days. We get 80 to 90% of people off all of their, let me say that again. We get 80 to 90% of people to reduce or get off all of their blood pressure and diabetic pills in 7 days.
Wow.
And, bowel movements start working well. Indigestion goes away. Almost everybody gets off their proton pump inhibitors like Prilosec and other antacids. They get off their blood pressure pills. The average drop in blood pressure is 804 millimeters of mercury, and still they stop their blood pressure pills. They feel really good. Their greasy skin goes away. They get color back in their face. They get their life back. And these are people who may be 40, 50, 60, sometimes 20, sometimes 70, who pretty much thought that life was over. They were feeling terrible. Their calendar was littered with appointments with doctors. They had to check their pill box several times a day, check their blood sugar several times a day. These people were basically living in the medical business. And when they changed their diet, most of the problems went away. Some stay, but not many. They stay on some pills. Remember, I'm a real doctor. I do prescribe pills. I think I had to reach for my prescription pad 4 times last week, taking care of more than 30 people. But I also probably, out of those 30 people, I probably stopped 50 drugs. So, it's just standard medicine. This is nothing that every doctor shouldn't be doing. I'm just a regular medical doctor. I just don't treat dietary diseases with drugs.
I love it. I love it. Well, Dr. McDougall, I think that's a great place to close. And so let me ask you a couple of quick questions before we close. And one is, besides the Starch Solution, are there any books you recommend? You've written a lot of bestsellers, by the way.
Yeah, 12 or 13, yeah.
So are there any books by other authors that you think are wonderful that...
There are, but I'll let you discover them on your own, because I only agree with one person 100%. So there are lots of people that write similar things and have valuable books, but then if I recommended them, I'd have to explain to you why they rate.
There's a discrepancy.
Yeah, there's a discrepancy.
Okay,
fair
enough.
My wife and I have been writing books for a long time, 4 decades. In fact, I'm about to sign a contract for a new book. I shouldn't, but I am. I think where you should go is you should go to our website. It is prolific in the amount of information. We have hundreds of videos, not only by ourselves, but by world experts, like the head of the Cochrane Collaboration, major professors from all over the world who we've interviewed on the website. There are articles on things from high blood pressure, which is coming out in this month's newsletter, to articles on breast cancer and colon cancer and how you cure inflammatory arthritis, with all of the scientific references there for you to look up. So you see, this is not some wacko doctor in Santa Rosa, California that came up with this daydream. This is all based on solid science published in the scientific literature. It's accessible to everybody thanks to the internet. It's just of no value. It has no financial value, and so nobody's interested in it. That's the problem. The money drives everything. Truth and success, which we have, is a very small motivator, except for those who need the truth and success, like you did, and I did, and everybody else does. They're just not aware it's out there.
Well, we're pushing hard to raise the awareness of the power of nutrition. And so where can people find you? What's your web address? Well,
my web address is drmcdougall.com, which is spelled drmcdougall.com. So drmcdougall.com, or you can just look up my name, John McDougall. It pretty much appears everywhere in Google. And the things that will surprise you is the quality of the site, the ease of navigation, and how much is there free. I mean, basically, everything's free. We don't let you come to our 10-day clinic free. We don't take you on our vacations to Hawaii and Costa Rica free. We give
man, come on.
Yeah, I know. We don't give you our advanced study weekends free, but all the information, there's like probably 400, 500 recipes up there for free. All the information you need to change your diet is there. All the information on your diseases is there for free. A great search engine. And Dr. McDougall's Color Picture book, I recommend you start with. That explains everything in just 66 little pictures. And when you step away from the simplicity, you go, oh, it's obvious. Why would anybody look at it any other way? It's obvious. So I'd start there.
Let me plug one other thing that you do. You touched on it, and I want to make sure people know what it is. But you have these 10-day retreats. It's basically a medical retreat, right? Where you're changing their diets, you're looking at their blood work, right?
Well, and they get the supervision by doctors. So like starting Friday, we have a whole group from Whole Foods Market coming. And I have 4 doctors seeing them. So it's a medically supervised program where we take people off their medications if it's appropriate, put them on medication if it's appropriate. And I thought you were going to mention the webinars we do.
Oh, you do a lot of great stuff. Feel free to talk about it.
That we do is once a week I do about 45-minute, half-an-hour webinar that's free, and you can sign up for those on our site. And you may be sitting back thinking, and lots of people do. I get emails like this all the time. Somebody will say, I found your website. I spent the last week looking through it, trying to find the gimmick. Where's the gimmick? Why are you giving all this away for free? Where's the catch? Well, we do have to make a living too. We have books and retreats, like you call them, and various things that we do to put shoes on our kids. Grandkids, actually, this day and age. But Mary and I were given this great gift about 45 years ago. We're given each other, but we're also given this gift of knowledge. And I was almost dead. We can go into that story sometime. But when I was, since I've been 27 years old, I'm now 68. Since I've been 27 years old, I've enjoyed good health because I was able to get away from Burger King and Dairy Queen and understand what to eat. Same thing with my wife and all my children and grandchildren. So we're given this great gift. And when you're given great gifts, you don't turn around and sell them. You want to give them away to other people. And so we've been giving this gift away for a long time. It's truly a gift. There's no gimmicks. It's all free. It always works. It's yours for the taking.
That's wonderful. Well, Dr. John McDougall, thank you so much.
It's a pleasure.
For your time. I hope we can do another one soon. This has been terrific.
Why not? You're a good interviewer. You have great enthusiasm to change the world, and it's going to take everybody to change the world. But we are going to do it.
Yes, sir. We are going to do it.
All right.
Okay.
Bye-bye.
Talk soon. Bye.